Let's talk about a hip dislocation. I'm Dr. David, orthopedic surgeon and sports medicine expert. In this video, I'm going to talk about a traumatic hip dislocation in younger athletes. There is a subset of hip dislocations that occur after hip replacements that's probably more geared for the joint replacement surgeons, which is not what I am. I obviously do sports medicine. So what I would see are the teenagers, the 20-somethings, the 30-somethings that have a very traumatic injury where they're in a car wreck or a serious fall or maybe a serious sports injury and the ball pops out of the socket at the hip. It takes a lot of trauma to do that. That's why I said that it's typically a mechanism like that. The hip just doesn't slide in and out of joint normally. It's a very, very stable joint. So it takes a lot of force to do that. Now, when that ball pops out of the socket, a lot of times as doctors we'll get x-rays, one, to kind of make sure that it's dislocated, see which direction it's dislocated, but also to know if you broke a piece of the socket or maybe a piece of the ball as the hip came out. That can be really important. Now, this is something that has to be dealt with fairly quickly in terms of popping it back into place. We typically do this in the emergency room so we can give you sedation and let the muscles relax so we can pop it back in place. Or sometimes we'll do it in an operating room setting where the anesthesia can make you sleepy and it pops easier back into place. Occasionally, sometimes we actually have to open it up to pop it back into place. But it's important that it's done fairly quickly because the longer that hip is out of place, that ball's out of the socket, you can damage the blood vessels around the hip, and that could lead to a condition called avascular necrosis where the bone of the ball and socket starts to die over several months or several years. But also, the longer it's out, you can damage the sciatic nerve behind the hip that runs all the way down the leg and controls a lot of the leg and foot and ankle function that's so important to daily life. So it's very important that that gets reduced fairly quickly. Now, what you have to do long term then really depends on, is it just a hip dislocation or is there a fracture with it? But it can be a long process to completely heal and get back to sports. And again, as orthopedic surgeons, we'll be watching for some of those other complications, especially the avascular necrosis, months and years later. But a very, very, very dangerous injury. Fortunately, it's fairly rare in young, active people. I hope this video was helpful. Click the video below for much more helpful content. Make sure to subscribe, and I'll see you next time.